Modern medicine is standing at a turning point. Artificial intelligence is not only changing how we detect diseases, it is transforming how we understand, analyze, and treat them. Today, algorithms can evaluate millions of medical images within seconds and identify patterns that even experienced specialists might overlook. AI-driven systems detect tumors earlier, analyze blood values more precisely, and help doctors develop personalized treatments tailored to each individual patient. This film begins at the intersection of data, diagnosis, and machine learning, a place where a new era of healing is emerging and where the hope grows that diseases like cancer may one day be defeated entirely.
Inside the Clinical Operations Hub, artificial intelligence supervises thousands of patients simultaneously. Each robot
Cancer is one of the most complex diseases of our time. Every type of tumor behaves differently, grows differently, and responds differently to treatment. This is where the strength of artificial intelligence begins. Modern AI models can analyze billions of genetic data points and detect patterns that remain invisible to the human eye. They compare thousands of patient histories, identify risk factors, and suggest treatment paths tailored to each individual. In many hospitals, AI systems assist radiologists in detecting tiny changes in tissue, often weeks or even months earlier than was previously possible. These new tools are transforming not only diagnostics but also hope, because the earlier a tumor is detected, the greater the chances of recovery.
Based on the latest scan, the vascular flow around your left lung remains stable. The highlighted section shows mild inflammation only.
So it's nothing serious?
Correct.
But artificial intelligence can do more than detect tumors earlier. It helps doctors choose the right therapy for each individual patient. In oncology, new models are emerging that can predict how a tumor will respond to specific medications long before treatment begins. This makes it possible to avoid ineffective therapies and gain valuable time. At the same time, AI systems analyze blood samples, tissue samples, and genetic sequences to understand the exact structure of a tumor. Some algorithms can even determine whether a cancer will grow aggressively or progress more slowly. These new capabilities are transforming how doctors make decisions. Instead of relying solely on experience and isolated findings, they can access vast amounts of data that are evaluated within seconds. This creates a form of medicine that is more precise, faster, and more personalized than ever before.
In this cleanroom laboratory, an autonomous research unit examines genetic code. Responsive holograms render each nucleotide in precise.
Yet despite all these advances, one truth remains essential: artificial intelligence is not a replacement for human doctors, but a tool that expands their abilities. The best results emerge where humans and machines work together. Doctors contribute experience, intuition, and empathy. AI provides speed, precision, and the ability to analyze vast amounts of data. Together, they create a form of medicine that is stronger than either side alone. In many hospitals, this collaboration is already transforming lives. Tumors are detected earlier, treatments are planned more effectively, and patients receive therapies tailored specifically to them. This film ends with a simple but powerful insight. The future of medicine is not purely technological and not purely human, it is the union of both worlds. And within this union lies the hope that diseases like cancer may one day be defeated for good.
Heart rate stable at 72 beats per minute. Oxygen level 97%. How are you feeling?
Tired.
As artificial intelligence moves deeper into medical research, another crucial advantage becomes clear: the speed at which new discoveries are made. In the past, it took years for researchers to identify patterns in large datasets. Today, AI models can analyze millions of clinical studies, laboratory results, and patient records within hours. This reveals connections that were previously hidden, such as which genetic mutations accelerate the growth of certain tumors or which combinations of medications are particularly effective. At the same time, AI enables a completely new approach to drug development. Algorithms simulate how molecules behave in the body and propose new compounds that traditional laboratory methods might never have uncovered. This acceleration transforms not only research but also patient hope. Because the faster new therapies emerge, the closer we come to a future in which diseases like cancer no longer seem invincible, but treatable, and perhaps one day curable.
Ventilation at target volume. Saturation steady at 98%.
Good. Hold this configuration and keep monitoring.
As AI becomes more deeply integrated into diagnostics and research, it is also transforming everyday life inside hospitals. In modern clinics, intelligent systems support medical staff by monitoring vital signs in real time and alerting them early when a patient's condition begins to deteriorate. AI-powered devices analyze breathing patterns, heart rates, and blood values, detecting irregularities long before they become visible to humans. At the same time, digital assistants help doctors navigate complex medical records and instantly find the information they need. This gives them more time for what matters most in medicine: direct contact with the patient. This technological support reduces workload, minimizes errors, and ensures that critical situations are recognized more quickly. It creates a new form of collaboration in which AI does not stand in the spotlight, but works quietly in the background, precise, reliable, and dedicated to protecting lives.
Initiating full anatomical projection. Vital signs stable, cardiac rhythm normal, respiratory rate within expected parameters, scanning organ systems for anomalies.
As AI becomes more precise and takes on more tasks, another crucial question arises: how do we keep humans at the center of an increasingly technological form of medicine? Doctors report that AI helps reduce routine work and gives them more time for conversations with patients. At the same time, new responsibilities emerge. Physicians must not only make diagnoses but also understand how algorithms arrive at their conclusions. This collaboration requires trust and transparency. Patients want to know whether a machine contributed to their diagnosis and how reliable that decision is. For this reason, researchers are developing systems that can explain their reasoning, why a tumor was classified as dangerous, which data influenced the result, and how high the probability of error is. This openness creates confidence and shows that AI does not operate in secrecy, but in a way that is understandable and verifiable. It creates a form of medicine that remains human, even when supported by machines.
Cardiac rhythm stable. Oxygen saturation 98%. No abnormalities detected in the latest scan. You may feel slight fatigue for several.
Cardiac rhythm stable at 72 beats per minute. Oxygen saturation 98%. No ischemic patterns detected. Recommend continued observation.
At the end of this journey through the world of medical AI, one insight becomes especially clear: we are only at the beginning. The systems that detect tumors, plan treatments, and accelerate research today are just the first step in a development that will fundamentally transform medicine. In the coming years, algorithms will become even more precise, diagnoses will be possible even earlier, and treatments will be tailored more individually to each person. Yet despite all technological progress, one thing remains unchanged: the importance of human compassion. AI can analyze data, detect patterns, and support decisions, but it cannot comfort, cannot listen, and cannot hold a patient's hand. The future of medicine will emerge where technology and humanity come together. And within this connection lies the hope that diseases like cancer will one day no longer mark the end of a story, but the beginning of a new chance. Thank you for staying until the end of this episode. If this journey into the future of medicine has inspired you, consider supporting the channel with a like, a comment, and a subscription. Every bit of feedback helps continue this series and explore new topics. Also activate the notification bell so you never miss another episode and always know when a new film is released. The world of artificial intelligence evolves every single day, and together we can follow, understand, and document this transformation. I look forward to having you with me again in the next part.